Hi, this is Jesse Rocha. Today, September 14. This is Anatomy Physiology 1, Bio 230. This is the overview of anatomy. These are just the questions. How does anatomy differ from physiology? Anatomy is the structure of the body parts, and physiology is the way the body parts function. Describe the anatomical position and explain why it's important. Okay, so palms have to be facing forward, face needs to be facing forward, feet need to be straight down, toes need to be on the floor, everything. This is important because it's the standard reference point of location and direction of the body parts. Show and explain anatomical direction. Okay, so anatomical direction is So we're gonna do superior, inferior, inferior, and then we have the anterior, posterior. We have the midline, which separates the left from the right. Then you have the medial, and going outwards will be lateral. And then for the limbs, we have distal and proximal. So distal and proximal. Distal will be considered, the ankles are distal from the knees. Now, we also have deep and superficial, which is the muscles are deep from the skin. Okay, show and explain anatomical direction, show and name the anatomical. So the anatomical region in terms of the body. We'll start off with cephalic. So cephalic will be the head area. So you have the frontal, the orbit, nasal, oral, and mental. And in the backside you have occipital, and which is the back of the head. And then you have cervical, which is the neck area. And then we have the thoracic area, which is sternal, mammary, axillary, and then you also have the abdominal area, which is here, and you have the umbilical area, or abdominal area, umbilical, and then you also have the pelvic area, which is pelvic, inguinal, and then the pubic area. Now we're gonna do the upper limbs, which is acromial, right here, branchial. Then we have the antecubical, which is this area, the olecranial, which is the backside of the limb, the higher limb. And then we also have the antebrachial, which is this side, forearm area. Then you have the palmar, which is this. Metapalmar will be the backside. The digitals are the fingers, and the thumb is the pollex. Yeah, thumb is the pollex, and so that's this, that, and then let's do we'll do the lower limbs, which is coxal, and then you have the femoral, which is this area, the patellar, which would be the kneecap, and then you have the crural, and fibular, which is crural. Fibular will be on this side. You also have the dorsal and metatarsal, which the dorsal area will be here, metatarsal, the digitals, and the hallux, which is the toe area. Okay, so that's the front side. Let's do the back side. So can you turn it around, please? Okay, so the back side, we're gonna do the scapular. This is the scapular area. This is the vertebral area, the lumbar, the sacral, the gluteal area, and the perineal area. Now, the lower limbs is femoral, and then the back of the kneecap will be considered popliteal. I don't know if that's saying that right. Polito. So the calf area will be sural, and then you also have the perineal area, which is like the inside of the calf area. And then if you could do me a favor, you could just lift your foot, one foot up, which would be the this area right here would be the plantar, and then the coneal area, which is like the heel area. So that's, you can turn back around here. So why is the knowledge of above topic important for clinical practice? So this is important because it helps like healthcare professionals accurately describe and locate conditions without any confusions. Thank you.